In this video, we'll be breaking down shoulder-controlled articular rotations, or shoulder CARs. What the goal of this movement is that we're going to take the shoulder through all of its articulations and ranges of motion, being external rotation, internal rotation, flexion, extension, adduction, and abduction. The reason we perform shoulder CARs is to get some blood flow to the shoulder as a warm-up. They're really great to be used as rehab if you're cleared for movement again after surgery or an injury. They're really great if you're newer to mobility to help you learn about the shoulder joint and how to articulate that shoulder joint. And they're really great as an assessment. So we're going to be able to see and explore how one side moves versus the other. So we're going to be using a few pieces of equipment. I've got a long stick, a short stick, a club, and something to squeeze. I'm going to be squeezing a massage ball, a baseball, tennis ball, even a rolled up sock works well, just so we get some extra irradiation into the end of the hand. The rest of the equipment is optional. You can use a small dumbbell instead of a club. This stick can also be used as an offset weight. So we're going to start with no equipment at all. We're just going to explore shoulder rotation in different orientations. We're going to be moving the arm from the shoulder. You're not exactly moving the shoulder when we're talking about shoulder mobility. You're actually moving the humerus, which is the upper arm bone, within that shoulder joint. So throughout all of these drills, we're going to be focusing on keeping the shoulder still and moving that humerus within the shoulder joint. Some other parts of the body may try to assist the shoulder in the movement as well. So your scapula may start to move around in this movement, which we don't want. We want the scapula to stay down and back throughout the movement. The spine, you may feel some rotation or leaning away from the arm as we go into that shoulder CAR. We want to try to keep that spine still. And I'll show you ways to help cue your body to really isolate that shoulder. So let's go back to our rotation. I want you to stick your thumbs up out in front of you. So we're going to rotate both arms at the same time first, and then we'll separate it into one at a time. So with the thumbs up, keep your elbows straight and drive your shoulders away from the ears. So we've got lots of space between the shoulders and the ears. And if we're going into internal shoulder rotation, you're going to turn your thumbs in towards the center of your body. That is shoulder internal rotation. You can see this upper arm bone rotating in. That's internal. Now, if we take our thumbs up and rotate them out, that's our external rotation. Let's do that 2 more times. Internal rotation, again, isolating the shoulder, and external rotation out. 1 more time into internal. Check in with that spine. Make sure the ribs are not flaring out, right? All of this should be isolated from the shoulder. So now let's go into shoulder abduction, which is shoulders out or arms out to the side. Now if we turn the thumbs forward, that's our internal rotation. Make sure that this doesn't happen concave of the chest. We're going to keep those shoulders down and back. And then we'll go to external rotation. And back to internal rotation. You might feel that one articulation feels tighter than the other. So internal is usually a little tighter than the external. The external, you may feel a little engagement in the lats. And let's do one more internal rotation. So tension is on the front of that shoulder with that internal. And now we're feeling the posterior chain, the back side of the shoulder, and those lats as you go into external. So now let's go into shoulder extension, which is arms behind you. So I'm going to face this way. Turn your thumbs up, down as you reach up behind you. Now if we turn the thumbs in, that's our internal rotation. If we turn our thumbs out, that's our external. 2 more, in. So now you're really going to feel those triceps working hard to keep those arms straight. And external, you try not to lean forward in the torso as you reach the arms behind you. And 1 more time, you'll feel the muscles in between the scapula working hard to keep those shoulders squeezing together. And external. So we've got 1 more articulation. We're going to go into shoulder flexion, which is arms overhead. Now with shoulder flexion, the goal is not to get your arms next to the ears at any cost by arching the spine or sticking the ribs out. We're going to go just as high as you can go without disturbing the ribs and the spine, up. This is your shoulder flexion, okay? So we're not pushing beyond this today. We're just going and exploring what your shoulder flexion is. So arms are gonna stay straight. Shoulders are gonna try to stay away from the ears as much as possible. Now in this flexed position, let's go into internal. So thumbs are gonna turn in and now thumbs out. That's external. Thumbs in, internal. Thumbs out, external. Thumbs in, internal, and one more, thumbs out, external. So now let's work one side at a time, a little bit more in depth with these rotations. I'm gonna grab a club. This is a 2-pound club, so a light dumbbell will work. What I like about this is it's offset, so one side is heavier than the other. You can also, if you have a stick, use your stick and just make one side longer. That will also help with the offset feeling of the club. So if my thumbs up is the heavy part of the club, we're gonna stick that out in front with the right arm. And let's explore these rotations again. So now the club is, or the offset load is gonna pull your arm into a little bit more rotation as you go through these. So we're just gonna do 3 on each side again. Back to internal rotation. We're trying to control this movement, not allow it to affect the shoulder, the spine, or the scapula in any way. We're just rotating 3 internal and 3 external. These are called shoulder capsule cars. There's so many different ways that you can do them. This is the simplest version. Let's go to the left side. So I've got that straight elbow. Wrist is remaining right in front of the shoulder, so try not to let that wrist drop. Try not to let the elbow bend. If you feel those compensations happening, you can cue yourself underneath the elbow to hold that arm out in front. You could even cue that shoulder by pushing down on that shoulder with the free arm. And one more into external. So now let's go to that abducted position with the right arm. So we've still got the heavy part on top. We're gonna slowly go into that internal and external. Again, not letting this affect anything else in the body. We're just rotating from that shoulder joint. One more time, internal, external, and let's switch. Left arm is going to be abducted to the side. Again, you can cue that shoulder down. You could put your hand on your rib cage, make sure that the ribs are not flaring here. Back to internal and external, always moving slowly and with control. Back to internal and external. Slowly come back center. Before we go into extension, let's do our flexion. So back in the right arm, heavy side is up. We're gonna bring that club or dumbbell or stick overhead. So now the heavy part is behind you. We're gonna drop into internal rotation. So this is a really great time to just assess how each of the shoulders move. So if you're in this shoulder flexed position, how stable is your shoulder in this position? Are you able to rotate just as far as you could when the arm is in front of you or to the side? Or is it a little wobbly up there? Do you have to work really hard to get that arm up or really hard to keep that elbow straight? Just things to notice. And then slowly come back down. We'll switch sides. Heavy part is on top. Bring that arm overhead. Let's go into internal rotation and external. Thumb points out. Heavy part out. Back to internal, show you from this side. So we're just rotating that humerus bone on its axis. One more time into internal and external and rest. Now when we go into extension, we're gonna flip it. So the heavy part is going to be on top, closer to your pinky finger, your little finger. So as you go up into shoulder extension, that heavy part is going to be on top. That's going to help you get into more rotation here. Keep the elbow straight as you go into internal, letting that heavy part fall outside of the body. And then going into external rotation, let the heavy part fall inside of the body. Make sure you're not compensating in the torso here. Keep that chest up nice and tall. This is going to come in handy later. Make sure that arm is not too far out to the side. We want that arm to be as directly behind the shoulder as possible. One more time into internal and external. Come back center. And let's switch sides. Heavy part is by that pinky finger. We're gonna push that club or stick or weight backwards, and let's drop into internal rotation. Heavy part goes outside of the body and back to external rotation. Not letting that arm fly out to the side. And internal, keep that arm lifting, back to external. And one more time, internal. So we're feeling a lot of deltoids, rhomboids, and traps with this one, lower to mid traps, all which help control the scapula and the shoulder when you're in extension behind you. Slowly come out of that position. All right, so now that we've explored our rotation of the shoulder in different articulations, let's start to build the shoulder car. So I want you to grab your ball or something that you have to squeeze. You're gonna wrap your left arm behind you. This is gonna help keep that left shoulder down and the left rib cage down. And that arm is also gonna help cue that spine. So if you feel that spine moving with this hand or arm, right, that's gonna help to keep that nice and stable. So we're gonna start with the arm down by your side. We're gonna do the first half of your shoulder car. So you're gonna externally rotate from the bottom with your right hand by your hip. So thumbs up is gonna point out. You're gonna sweep that arm across the body. This is our shoulder adduction. We haven't really done much with this because this is the only part that we're really adducting the shoulder. As you bring the arm up into flexion, you're gonna keep external rotation and keep that elbow straight. Throughout the entire shoulder car, the elbow is gonna stay all the way straight. Try to keep that external rotation. Squeeze that ball even harder as you come overhead. Now, once you start to go up into shoulder flexion, you're gonna lose some of that adduction. I'm not purposely moving my arm out. I just don't have as much as I get across. So I'm still trying to reach that arm across my body, but once I get to a certain point, it just falls out on top of my shoulder. So we're still externally rotating as much as possible. When you can't go any further without letting the rib cage flare or bending the elbow, then you're gonna slowly start to internally rotate and see if that internal rotation helps you get that arm next to your ear. Then you're gonna reverse the movement. Notice how my shoulder is staying down as much as possible here. So I'm gonna keep that shoulder down as I externally rotate again and reverse the movement. Bring the arm across my body as I come down in front. Keep squeezing and breathing all the way to the hip and across. Let's do that one more time. So I'll show you from the side. I reach across into adduction. I'm in external rotation. Try to keep as much rotation, keep that elbow straight, keep as much adduction as possible as you start to reach overhead. We're working very slowly. With each inch you lift up, you're gonna lose a little bit of that adduction. Try not to lose that external rotation, which as you get close to the top will start happening. Then once you can't go any further, see if you can internally rotate, getting that arm next to the ear while keeping that rib cage down. Go back to external, squeeze that ball, bring that arm across the body as you slowly bring it back down to the hip. Now let's switch sides. So now the right arm is gonna go behind you. I'm externally rotating that left arm, pulling that shoulder down and back. Make sure that spine stays nice and still, and we go across. Shoulder adduction, reaching across the body. Keep adducting, keep rotating. As you lift that arm up, fight for that rotation. Fight for that adduction. You'll feel the inside of your shoulder working really hard to keep it as tight across the body as possible. You'll start to lose some of that adduction and rotation as you get to your flexion. Make sure you're not leaning or arching or rotating. Once you can't go any further, see if you can internally rotate and push a little bit more and then reverse it. Externally rotate, keeping the ribs down. Bring that arm across the body. Fighting for more adduction as you come down. Down to the hip and across. Let's go one more time. Reaching across the body, slowly pulling that arm up. Squeeze that ball for more tension. The more tension we can bring to that shoulder, the deeper ranges of motion we can achieve. Once you can't go any further, we're gonna rotate. Keep fighting for more. And then reverse. Bring it in across. Keep that spine nice and still. As the arm comes down, you're going to be able to drop that shoulder more and more and more. And rest. One of the biggest compensations is bending the elbow once you start to get to that shoulder flexion. If you start bending the elbow, I want you to extend it and don't go any higher. So if I start to bend my elbow here in order to get my arm next to my ear, then I'm not using the shoulder anymore. I'm bending the elbow and using the elbow instead. So once you start bending, that's probably as far as you can go, and that's going to be your shoulder flexion. That's what you're working with right now. We're not necessarily going to be improving that articulation. We're just finding out what it is and assessing. So if you're doing a lot of overhead movements, but that shoulder struggles to get in that overhead position, you could be putting yourself at risk, and that would be a sign that you may want to address the shoulder rotation and shoulder flexion so that you can do safer overhead movements. So let's put the back half into this. So we're gonna start right from where we left off and attach the back half onto it. So I want you to grab your long stick, or if you have the wall close by, you're gonna basically get yourself right up against the wall. So I'm gonna hold the stick right at my chest so it attaches right at my sternum. That's my stability point. So I don't want my spine to move off of that, and I don't want the stick to move away from me, right? So I want that stick to be perpendicular to the floor the whole time. So going from that shoulder flex position, we're gonna internally rotate. So even if you're here in that shoulder flexion, that's where you're gonna start. And I want you to imagine that you're in a very narrow hallway this way. As you go into extension, try not to reach that arm straight up to the side. We are going to try to reach that arm across the body as soon as possible and as much as possible. As you're reaching that arm back, right? It's like if you have a wall right next to you, right? So that wall is preventing that arm from going out to the side. As you're doing that movement, you're gonna find more and more internal rotation. Here's where this tends to happen. Don't let yourself lean away. So I'm keeping myself right up against the stick so that my spine doesn't move at all. Now, once you are in your shoulder extension, once the arm is behind the shoulder, I want you to see if you can find even more internal rotation. So that thumbs up is going to turn in and up. Keep that elbow straight and then slowly bring that arm down to the hip. Now, when you bring the arm down, you're just going to stay in internal rotation. So the top of your hand is going to be facing your hip. And then you're going to reverse that movement. So keeping the internal rotation, you're going to reach straight back. Now, once you can't go any further, can't get any higher, you're going to start to externally rotate. And as you're externally rotating, bring that arm behind you. If you're in that narrow hallway, without rotating your body towards it, next to the ear. So that I'm squeezing it in. Now let's do that again. So once I'm at that shoulder flexion again, I'm going to rotate. Bring that arm across. Keep it nice and high without leaning, lifting the shoulder, bending the elbow, right? Less is more when it comes to these movements. And down, top of the hand is facing the hip. Now squeeze the ball and reverse, reaching up behind you. Once you can't go any further, you're going to start to externally rotate, keeping the shoulder away from the ear. Don't turn your body towards that arm. As you start to lift up into flexion and rest. Okay, so now let's try that on the other side. I'm going to face this way. So again, spine is staying nice and still. We want the shoulder blades to be down and back into the back, right? So we're pinning those shoulder blades down. From this shoulder flex position, we're going to find that internal rotation. Continue to internally rotate as you reach that arm behind. So each inch that you drop the arm, you're gonna reach it across the body an inch, right? It's a give and take. So the more you can get into shoulder extension, the more you can reach that arm across the body, the more you can internally rotate. Now, once you get here, see if you have a little more internal rotation, and then keep that rotation as you reach up. So now we're in extension. Once you can't go any further, start to externally rotate, but not so much that you're gonna just fly that arm out to the side. It's a give and take. So the more you reach that arm up behind you, the more you can externally rotate that shoulder, bringing it up next to the ear. Let's try that again. Internally rotate. Keep rotating. It's a give and take. The more you rotate, the more you reach the arm across, the more the arm drops. Try to keep that shoulder nice and still. Bring that arm down, find more rotation, and reverse. So I'm gonna show you, if you don't have a lot of shoulder flexion, what this will look like, or a lot of shoulder extension, right? So it might come out to the side as you reach up to your flexion, right? So if you're having a hard time, or if you're brand new to this and are just trying to figure it all out, keeping that arm a little bit lower is gonna help you figure out those articulations. And if you're limited in your shoulder mobility, it's gonna help you learn how to use your shoulder the way that it's meant to be used, so that you're not stealing from other surrounding joints. Nobody cares how much your shoulder can move. You're gonna get more benefits out of the movement if you do less, right? So less is always more with these cars. So now let's put it all together. So you could put your stick down, and we'll go back to this block. So you're gonna block your opposite side with your arm behind your back. If you are really comfortable with that stick out in front, you can of course keep that for these shoulder cars. If you feel really, really good there, you can also get up against a wall and place this supporting arm behind you on the wall, right? So I'm driving this supporting shoulder into the wall. This arm is on the wall. So there's basically no way that I can possibly use this side of my body to help with that movement. So we're gonna do 2 on each side really slow. So let's go with the left hand behind the back. It can be low or high, whatever helps keep that shoulder down and the spine still, the hips still. We're gonna externally rotate. Keep that elbow straight as you swipe it across the body. Keep the rotation as you come up. And I really want you to just envision your humerus bone moving within that shoulder joint. The shoulder itself is staying still. Once you get to the top, we're gonna go into internal rotation and continue that movement into extension. Reach that arm behind you with that give and take. The more you reach behind, the more it comes across the body, the more you can rotate. Bring the arm down, and then we'll reverse, reaching back in extension with internal rotation. Once you can't go any further, start to externally rotate, squeeze that ball. Keep the spine straight. Bring it across the body, keep rotating. And let's go one more time. Try to smooth out the edges of this car. Okay, so if you feel like you're getting stuck in one spot, really squeeze the ball and bear down to push through that sticky moment. If I feel a little pinch right here, then you're gonna go around that pinch. You're gonna come out of that movement just slightly to get into the next, right? We never wanna push through pain. That's our body trying to tell us something is wrong. So we wanna just kind of come out of the range of motion if you're feeling that pain, and then just get back into it when you can. Back to flexion, slowly bringing across the body. All right, that's 2. So I'll show you from the back this time, or this diagonal. So I've got my right arm reaching across. Go ahead and find that stable position. Hips, spine, and shoulders all stay nice and still. Let's find external. Sweep that arm across the body as you come on up to flexion. Keeping that elbow nice and straight, especially right here. If you feel that elbow dropping or bending, then you got to drop that arm a little bit. Take some of your ego out of it. Find internal. Bring the arm down and reverse. Exhale as you reach back behind you. Remember to breathe. Smoothing out the edges here. It's a give and take. The more you reach that arm up, the more you can bring it across the body, the more you can rotate. Right? But we don't want that to happen all at once. And let's go one more. Swiping across. Keeping the shoulders still. Now, as you reach the arm overhead, the scapula does have to elevate slightly, but we're going to try to minimize that as much as possible. Reaching around, finding internal rotation. And one more. Reverse. Fighting for that rotation. Give and take. Find more with each inch you lift. Swiping across the body and coming on down. Whew. All right. So those are your shoulder cars. I hope you learned something about your shoulder mobility today, and I hope your shoulders are feeling excellent. If you have any questions, drop them in the comments below, and I'll see you next time.